In order to be more accessible, we've enabled captioning for this webinar. You can turn on captions in your view by looking at the Zoom toolbar and clicking the three dots that say more to click the closed captioning option. Okay. Please feel free to share any questions in the chat as we go through the slides. I will make sure that all those questions get asked during the Q&A section. Okay. Coming up. Ms. Emory has no relevant financial relationships, and all relevant financial relationships have been mitigated. Without further ado, I will introduce Ms. Julie Emory. Julie Emory is the Pediatric Medical Home and EPSDT Coordinator with the Bureau of Family Health's Family and Community Systems team. BFH administers the Title V program along with many other federal grants and sits within the Louisiana Department of Health, Office of Public Health. Julie is primarily responsible for provider engagement and capacity building to elevate the family experience in a pediatric medical home. Okay, and now I will pass control over to Ms. Emory to begin the presentation.
Thank you so much. If you guys will give me just a minute and I will get my slides pulled up and we will get started. All right, everything look okay, Julia? I'm assuming, hoping. We're good. Okay, happy Thursday, guys. Welcome to Breeze into Care Coordination with the new interactive toolkit. Like she said, my name is Julie Emory, and I am the Medical Home and EPSDT Coordinator for the Bureau of Family Health. I want to give you guys just a... Oh, well, not advancing my slides. There it goes. Okay. A quick highlight on the things we'll touch on today, just kind of get a feel for the cadence. I will introduce who we are, Pediatric Medical Home, of course, talk about care coordination and the toolkit, and then additional supports from the Bureau of Family Health. I appreciate you guys enjoying or choosing to spend your lunch break with me, and I'm excited to be here today. I'd like to first introduce the Bureau of Family Health. If you're not familiar with us, we are housed under the Louisiana Department of Health, Office of Public Health, and strive to promote the health and well-being of Louisiana families from one generation to the next. We offer a variety of resources and services directly for Louisiana families, as well as data to support healthcare, social service, and public health professionals in their work. A few examples of programs that are within our purview include the newborn screening program, home visiting, nurse-family partnership, and parents as teachers that you may have referred to in the past, and then also the fetal and infant mortality review. So to orient us all on the need interstate, let's take a look at the existing risks throughout the population of Louisiana's children. These statistics are generated from the 2020-2021 National Survey of Children's Health and report that Louisiana is second in the nation for children living in poverty with a 26.3%. Also, 23.2% of our children ages 0 to 17 have at least one special health care need. And then 29.7% struggle with a mental, emotional, developmental, or behavioral problem in the age range of 3 to 17. And then of those kiddos with a special health care need, only 39.7% report receiving care in a medical home. And then finally, less than 16% of our children living under the federal poverty level in Louisiana receive care in a medical home. I want to provide a brief overview of the patient and family-centered medical home before unpacking our newest toolkit. The American Academy of Pediatrics and the National Standard for Systems of Care for Children and Youth with Special Healthcare Needs endorse care in a medical home as the gold standard of care, ensuring a holistic and coordinated healthcare model for pediatric populations and their families. The AAP goes on to say that the medical care of infants, children, and adolescents ideally should be accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective. It should be delivered or directed by well-trained providers who provide primary care and help to manage and facilitate essentially all aspects of pediatric care. Many components of the medical home are supported by the AAP, but for the purpose of this presentation, we're going to predominantly focus on the provision of care coordination services in which the family, the physician, and other service providers work to implement a specific care plan as an organized team. Outside of the endorsements, why is care coordination important? Care coordination is not only a core element of the pediatric medical home, it is also a core component of the federal and state efforts to improve population and individual health outcomes, reduce caregiver and family burden, eliminate redundancies in care, and seeks to reduce healthcare costs. In addition, care coordination is a vital element to ensuring the full impact of the EPSDT benefit. Successful care coordination in a medical home requires that providers address patient and family needs that go beyond health and medical care. This includes financial, education, social, and community elements that affect a patient's overall health and well-being. To truly be comprehensive, coordinated, and continuous, a practice should have a strong partnership across multiple sectors that make up a patient's care and social service network. A quick example regarding screening. We know that it's not enough just to screen, and whether we're speaking to developmental milestones, autism, or caregiver perinatal depression, an effective screening process relies on successful referrals. When a risk is identified through screening, care coordination is that next step. In order to be effective and for the families to experience the positive benefit, it should be consistent and timely. And then once referred, follow-up is key to ensuring that children and families are linked with those services and there were no barriers to utilization. So I want to briefly talk about supported outcomes of implementing quality care coordination services. And that looks like access to coordinated, ongoing, comprehensive care within a medical home, having those family professional partnership at all levels of decision-making that really elevates that family-centered care, access to adequate financing and private and/or public insurance to pay for those needed services, organized community service referral for easy use, and then also thinking about transition from youth to adult health care and that work and independence. And there's certainly a lot of care coordination that goes into that for an adolescent to be able to effectively transition into adult primary care. As we prepare to unpack the toolkit, we can first acknowledge a few high-level notes. The toolkit is designed to support individual practices with improving and/or expanding care coordination services at the clinic level. It uses a stepwise quality improvement framework designed to maximize clinic capacity while ensuring that implementation is efficient and effective. And it was created for primary care pediatric practices, but can certainly be used by other healthcare or social service professionals. The toolkit also provides clinic teams with the information needed to develop and implement improvement targets for care coordination services and any family requesting linkage to services. Of course, we're not just speaking to children and youth with special health care needs. And then finally, its intent is to be customizable and allow you to assess, plan, and ultimately implement services at your own pace based on your own needs with implementation. So let's get started. The toolkit was updated and published online last year in 2023. The original version was released in 2014 in a PDF version, and it was implemented and tested in multiple partner practices. It is found on the Bureau of Family Health's website, and it's available free of charge. If you would like, feel free to snap a picture of the QR code on the screen and it will take you directly to the toolkit. And then the screenshot on the right of your screen is what you will find on the toolkit homepage. Again, the toolkit provides that three-step framework for integrating care coordination services from scratch or expanding on your existing clinic activities. And it will guide you with training as support, as well as linking you to relevant resources. It was designed by a team of experts and it follows best practices and research. It also includes some standalone tools along with state and national resource links that will support a variety of your quality improvement activities. Okay, the toolbar picture is at the top of the toolkit homepage, and it will help you navigate between the steps. Each step has its own page with tools and worksheets embedded within that page. And practices at various levels of implementation can access what is the most beneficial for their staff, as well as use it interchangeably. All of the worksheets available can be downloaded and printed if you choose. So here are our objectives specifically for that toolkit. I'm hopeful that as we walk through, you will gain an understanding of how to assemble that clinic team to assess your current care coordination services and decide and determine the improvement targets. We hope that you are able to use the capacity checklist that we will introduce, develop an implementation plan for those improvement target using our worksheets or any other quality improvement tools that you may be familiar with. And then we hope that you will be able to access our regional pediatric referral guides after we've walked through that. Okay. So let's jump in. All clinics provide some level of care coordination, whether that's having a process for scheduling patients or having a full-time care coordinator to complete referrals. Doing an assessment and a deep dive into your clinic's activity is the first step in improving care coordination services. To aid with this step, we have provided a care coordination capacity checklist that guides you in determining the extent to which care coordination elements are taking place in your practice. Key elements are based on national standard domains, and they include screening, identification of children and youth with special healthcare needs, assessment of needs, shared plans of care, linkage to resources, appointment scheduling, the staff roles and policies, youth transition, and finally, quality improvement. So once you have an idea of your current practices, you can then identify the most feasible elements that you can add to or improve upon. So this is a little snapshot of what the care coordination capacity checklist will look like. Each element is broken into 3 different levels of implementation based on clinic capacity. And those are going to be basic, intermediate, and advanced. Basic refers to clinic structures that may limit or restrict service provision due to a small number of staff, lack of technology tools and data systems, spatial restrictions, and things like that. Intermediate refers to practices that have the staff and physical space to support comprehensive care coordination services. And these level 2 practices have a functional data system or EHR and have the mechanisms to modify that system. And then advanced will refer to practices that have at least one designated care coordinator on staff who works to develop, implement, and ensure follow-up for the patient plan of care. This care coordinator will track outcomes and drive the quality improvement efforts. For each care coordination element, you'll move across the row and put a check next to the elements that best describe your current clinic activities. For some of the elements, you may fall into the basic level, and for others, you may be advanced. But we want to focus in on the elements where your clinic is at that basic or intermediate level. And these are likely areas for improvement, obviously. And so we're going to circle 1 to 3 elements that would be most feasible to improve on at this time, and you'll use those in the next step. So now you've identified those 1 to 2 elements to improve on in step 1. And now you'll need to think through what is needed to implement change. Our toolkit provides brainstorming and project planning worksheets that can support this step. And essentially the goal is to create a step-by-step plan to implement or improve the identified care coordination task, thinking about who all is involved and how they will be trained. So on your screen, you'll see a brainstorm worksheet that's included in the toolkit. Obviously will be blank. We've got an example that you can also see. In this particular example, the clinic is going to focus on systematic and universal methods used to identify children and youth with special healthcare needs patients' charts to ensure consistency and efficiency of support and services. So the next step would be to think about what is needed for that change. So some of the examples could be, where do we flag the chart? Who's going to flag the chart? Does IT need to be involved? How will we train the staff? And when you're going through this step, it's really beneficial to have multiple people and different types of staff involved in the brainstorming, and that allows you to get a really robust view of the change and what is needed for the change. So moving on to step 3, quality improvement is the framework used to systematically improve the way healthcare is delivered to patients and their families, and it refers to the process of planning and testing changes on a small scale with the goal of implementing them across the entire practice. The toolkit utilizes the Plan, Do, Study, Act, or PDSA method of QI to help you figure out which strategies work best in your practice. The PDSA provides a systematic framework for working through tasks and will help you document the process, communicate with staff, and work through any issues or barriers that may arise. And we want to make sure that all the staff involved in this particular change are viewing the change from a QI lens. And these resources and these worksheets and these toolkits will really help guide that, especially for your staff that may not be as familiar with that QI framework. So let's look at a PDSA worksheet. Again, we have these blank in our toolkits, and we also have an example. For this particular PDSA, our goal is to flag charts of children or youth with special healthcare needs and provide families with referral and relevant resources. So this particular goal could also be broken into 2 separate PDSAs, or honestly even more, especially if there are different staff involved or we have different ways of measuring success. But for this purpose, we have it together. So of course, we're going to plan, we're going to do, we're going to study, and then we're going to act based on the results. We may decide that we want to adapt, adopt, or abandon based on our experiences. And so remembering that the toolkit offers these blank PDSAs, and like mentioned before, this is an example of one of those standalone tools that can be useful for all of your QI activities. And the one thing that I always like to remember, that always sticks with me when we're talking about improvement, is thinking small. What can you do by next Tuesday? So sometimes implementation of care coordination, elevating care coordination, feels so big because there's so many components to it. But when you're taking it from that quality improvement lens and you encourage and support your staff members through that lens, we're thinking really small. We know we have this big goal, but using this guidance in our toolkit, what can we do by next Tuesday that will help us reach that big goal that we know that all of our kiddos are experiencing that maximum benefit of care coordination services. While there are many resources available to help guide this process within the toolkit, we also have a team of experts available to provide implementation training and support, or ITS. So care coordination ITS consists of a variety, many different options that allow you to interact with our content experts and receive support tailored to your clinic's wants and needs. We can provide guidance, help with decision making and problem solving, and really coach you through implementing changes in your practice. Utilizing this toolkit to implement and or improve care coordination services will certainly position you for success, but we are also happy to provide further support at no charge. In addition, the toolkit offers additional resources that are related to care coordination and support of children with special health care needs. The resource tab will direct you to care coordination and local referral resources, other state agencies that provide care coordination, resources that will support your family engagement efforts, and then resources that you can directly share with families. I encourage you to review these resources to get a better understanding of the supports available to the patients and families you serve. But I want today to call attention to a couple of the resources. First is the Family Resource Center, or you might hear us say FRC. And it is designed to assist providers in linking families to services such as early intervention, childcare assistance, insurance assistance, the eligibility or applications, disability support, obtaining housing, and that's just to name a few. The FRC does an amazing job at assessing individual needs and making sure that we do our best to have those needs met. Staff occupy the email and phone line Monday through Friday, 8 to 4. And service families and providers virtually statewide. So an amazing opportunity that reach families across the state, and really make sure that we are addressing the needs of all the different pockets of both rural and urban populations. The FRC is both provider and family facing, so a provider can certainly access this service to help their families connect, but a family can also contact and ask for assistance as well. There's also local resource guides with recommended pediatric and adolescent services and programs available to children and youth with special healthcare needs, available under the resource tab again. These guides are specific to each region in the state and contain contact information, eligibility requirements, and a brief description of the services offered by each organization. They are updated annually and they're our most utilized referral resource. So if I go back here, you'll see this the state image on the right of your screen, and you can see the different regions in different colors. And so you're able to click on those regions, and access the referral guide that is specific to your region. The one shown on the screen is region 2, and it lets you know what parishes that falls into. Sometimes providers may be sharing a region depending on, their patients may come from different parishes. So you'll be able to see up top, making sure that you're using the right one for your families. So as we begin to close out this presentation, I want to take a couple of minutes to share a few other resources that you can access to support your pediatric practice. This is a snapshot of all of the provider toolkits available to you that you can find online, and I encourage you to check them out. So the first thing I want to talk about is developmental screening. For developmental screening, we offer a toolkit as well as individualized support and training, and that is led by our developmental screening coordinator, Dr. Teresa Northington. There is a QR code for quick access if you prefer. Otherwise, it can be found by simply putting the Louisiana Developmental Screening Toolkit into your search engine, and it pops up as the first one. And then within that web page, you'll also find our developmental screening guidelines that includes recommended screening tools and time intervals for those screenings, which includes development, autism, perinatal depression, and barriers to health. You'll be able to find all of those things on our webpage for under developmental screening. I also want to mention developmental monitoring. I am one of 2 ambassadors in the state of Louisiana that support implementation of the CDC Learn the Signs Act Early initiative. I highly encourage you to invest some time in looking up the resources there. It's a great initiative that offers free materials that are family facing and aim to support families with monitoring their child's development. Those free materials include checklists from ages 2 months to 5 that can be printed out. There's also free books that can be ordered, and there's also an app that they can really begin that partnership within that family-centered care and monitoring the developmental milestones for their kiddo. And then another toolkit is our youth health transition. This toolkit is for healthcare or social service professionals working with teens and young adults who want to integrate youth health transition services into their regular clinic practice. It is based on clinical practice guidelines from national experts and lessons learned from the field. This toolkit is currently in a PDF form that that QR code also brings you directly there, but it is on track to match the web versions of other toolkits in the next couple of months. So we're excited to be able to have all three of our toolkits web-based and interactive. So be on the lookout for that. But if you want to go on today, you can certainly access the PDF version. Also, when I have the opportunity to speak with any pediatric providers, I always like to mention Vroom. Vroom helps parents elevate their child's learning during the time that they already spend together, like doing laundry or driving. And it meets parents where they are through the people they already trust and the places they already go. Vroom provides tips based on science and the idea that parents already have what it takes to be a brain builder. And so there's printable materials and tips available at Vroom, and there is also an app. So I encourage you to check that out as well. So to close out, here is an overview of some changes you may want to think about for your practice. So thinking about spending some time reviewing the toolkit and determine where to start and what best fits your needs. If you feel as though you're maybe not ready to implement some test of chains for care coordination, but maybe you've never accessed those resources, that would be a great place to start. Or maybe you look and it's too much. It's not something that you know exactly where to start or want to kind of problem solve with one of our training experts. You can certainly contact us and we'll be glad to do that. You may want to identify those care coordination elements to improve on and go ahead and make that plan. You're ready. Maybe it's something you've been thinking about, and that's what led you to this webinar today. And so you may need just that additional resource, those additional tools to get started of making in your plan. And like I said, being able to incorporate those region-specific resource guides into your referral practice. Maybe when you look at it and you sit down and you say, where are we referring and where are those gaps of referrals and how can we better access what is in our community or what is in a neighboring parish to help meet the needs of our families. And it's certainly, if it's not listed on that resource and referral guide, and if it's something you don't know how to gain access to, the Family Resource Center is a great place to start and to look for that additional assistance. So I want to thank you guys again for spending this time with me today. I think we're going to have some time for Q&A if anyone has any questions. But if you are watching the recording or you have any questions following this presentation, you can certainly reach out to me and I will try to answer. And if I don't know the answer, I'll be able to triage you to one of our team of experts that have that expertise in the content area, and I will be happy to do that. So I appreciate your time, and I will toss it back to Julia, I believe.
Thank you, Ms. Emory.
Questions.
If anyone has any questions, you are welcome to go ahead and unmute at this time to ask your questions. You can claim your credit for this activity by doing your evaluation, which is at the link in the chat. I will also send that via email at the end of the webinar. I'm going to leave the evaluation code up there, but anyone have any questions, go ahead and ask. Yes, one question that I maybe have is what are the the things that you see is that people have that are challenges for people trying to implement care coordination.
So I think that there's always a lack of resources, number one, and especially depending on where you are in the state, that is always a challenge. The neat thing about, number one, really having a robust system in place is that that's given you time to know where your go-to referrals are. And then if you need to spend a little extra time on a unique case, then you kind of have that workflow built in. And then also remembering to access our Family Resource Center, because they can do that groundwork for you to help identify those resources, and or may have already heard from someone else and have identified it. So that's often challenging, as well as, just finding the time to offer those services and the staff to do it. But when you look at it and you work through these small tests of change in the QI lens, we find that our clinics are most successful of reaching that big goal when they first look at it in small goals.
Yeah, that makes sense. Any additional questions? I thought I maybe heard someone start to ask a question. Okay. Well, as I said, make sure that you scan the QR code or go through the link in the chat to take your evaluation. It takes less than 2 minutes. Even if you don't specifically need credit, it really helps us make sure that we have the information we need to continue to improve. Our next webinar will be January 25th, Physician Contracts Beyond Compensation, with Michael Johnson, who is a contract lawyer, and he will be talking about the ins and outs of contracts and negotiations for physicians. In February, we are excited to announce that we will have Julie Sweetland from the Frameworks Institute to present Boosting Public Discourse, Evidence-Based Strategies for Reframing Child and Adolescent Immunization. This talk focuses on speaking in the public domain about vaccination, so on social media or on your website, kind of beyond, it doesn't particularly focus on like one-on-one conversations about immunization. So that will be February 27th from 6 to 7:30, and this activity is accredited for 1.5 AMA PRA credits. And then August 16th through 18th, 2024, we will have our Senla Potpourri in Alexandria. Our call for proposals is open now. So if you're interested in presenting at the Senla Potpourri, please go ahead and submit a proposal. Those proposals are due February 2nd for our conference in August.